Hey, this is Dr. David Song from the Rehab Hero Clinic. Today we'll be talking about cervical meniscoids as a source of neck pain. So let's dig deep. Cervical meniscoids are a combination of connective tissue and adipose tissue that's found in the joint capsule. This meniscoid can get entrapped in the zygapophyseal joint and can lead to pain when entrapped by that joint. This happens because the cervical meniscoid is actually highly innervated with nociceptors. The function of a cervical meniscoid is to actually provide the joint some extra stability by filling up the space in that joint. First, we're going to start off with two self-tests to see if you actually have pain due to a cervical meniscoid. The purpose of these orthopedic tests is to reproduce the pain that you're experiencing in your neck. Now, these tests are also used for other types of conditions, including cervical radiculopathy. So it'll be really important to still contact your healthcare provider to see what condition you actually have. First, we're going to do what's called the cervical compression test. For this test, all you gotta do is give yourself a bit of a chin tuck, place both hands on your head, and compress your neck downwards. If this actually reproduces your pain, it's considered a positive test. The second test we're going to do is called the cervical Kemp's test. For this test, you're going to take your head, rotate it 45 degrees, and then look up to cause cervical extension. You can try this on both sides. If either side reproduces your neck pain, it's a positive test for a cervical meniscoid as a cause of your neck pain. Next, we're going to go over 3 exercises that you can do to relieve that neck pain. If cervical compression causes re-irritation of the cervical meniscoid causing neck pain, then cervical distraction, which is the opposite type of motion, will help to alleviate it. For this exercise, you'll need a heavy-duty strength band and somewhere to anchor it to. First, you're going to start by taking the band and lying down on your back. From here, you can allow the band to pull your skull towards the anchor point. You should feel a soft but consistent distraction going through your cervical spine, alleviating any type of irritation that you might have from the irritated cervical meniscoid. Generally speaking, you can stay in this position for up to 30 seconds, and you could do this multiple times a day. This exercise is generally done once in the morning, once at night, or as needed if you're experiencing cervical meniscoid irritation symptoms. Next, we're going to go into our second exercise. Now, this exercise seems a little bit silly, but it's called the ghost head exercise. The purpose of this exercise is to introduce some neck mobility movements into your cervical spine, and this will help to mobilize the cervical facet joints. The more mobile your cervical facet joints are, or the zygapophyseal joints are, the less likely you're going to entrap that cervical meniscoid. For this exercise, you'll be looking straight forward the whole time. You want to keep your shoulders squared forward as well. Next, you'll like to imagine there's a pencil coming up from the top of your head. Imagine that this pencil now needs to draw a halo above your head. By doing so, you'll move your head forward and then slowly move your neck so that your head is drawing a circle or a halo above it. And this exercise is quite difficult to do correctly without the aid of a mirror. You don't need to do perfect form. The whole point is that you're trying to get your neck to start mobilizing in a novel movement pattern. The purpose of the quadruped neck circles is actually to create more mobility to go through the neck. In this exercise, it's really important that you try to aim for the largest range of motion that you can create without reproducing your symptom. We really don't want to re-irritate the structures that are involved, but we do want to gently oscillate and move into them so that we can reintroduce those movements back into our daily lives. Start by just going on your hands and knees. Make sure you're on a padded surface like I am so that it doesn't hurt your joints. And you're going to create the biggest neck movement you can. I like to do about 5 repetitions in one direction. And it's really important that you try to isolate the movement to your head and neck and to minimize movements happening in your back and shoulders. After about 5 repetitions, you can switch sides and do the same thing. This exercise is best done if you take your time to go through the motions. Really appreciate where your limitations are as you proceed through this exercise. Well, that pretty much sums up how you can test yourself with 2 different tests of whether or not you have an irritated cervical meniscoid and 3 different exercises you can do at home to alleviate the irritation of that tissue. Once again, it's going to be really important that you first get your neck assessed by a healthcare professional to make sure it is not some other differential diagnosis. Depending on where you live, you could go directly to your chiropractor or physiotherapist to see if you have any of the other types of conditions that can affect your neck. If you guys enjoyed this video, I really appreciate if you hit that subscribe button, give this video a like, and if you have a question, leave a comment in the comment section below. If you guys haven't already checked out our Instagram page, go ahead and check it out. We have over 360,000 followers on there, and our TikTok has over 140,000. We'll see you guys online. Until next time, see ya.